Good afternoon, everyone. This is County Executive Pat Ryan. I hope you are doing well on this Thursday afternoon. Thank you for tuning in to our twice weekly COVID update. Today, we're going to be focusing both on the current situation with COVID in Ulster County, and also we're going to talk a little bit about what each of us can do, what each of you can do to make sure that as we continue to move forward and continue to try to keep the community safe and healthy, we're each doing our part, particularly as part of our rapid response plan, as we've seen a few small number of clusters emerge in Ulster County over the last week. We will start, as always, with the data and with the numbers. So in terms of our total cumulative positive cases since the beginning of the COVID pandemic, we are at 1,868 total cases. And that's out of now over 41,000 residents that have been tested in the county since the crisis began in March. Unfortunately, and as a sad reminder of how serious and deadly COVID is, we have had 87 fatalities among Ulster County residents. The good news, we continue to see the number of recovered go up steadily. We're now at 1,644 recovered. In terms of the 10-day projections that you can see there in the green, yellow, and blue lines, we're still basically holding what we were 48 hours ago. If you look out 10 days, the worst case projection would have us at about 2275 total positives. The very good news, I think, especially after the concern of the spike that we had throughout the holiday weekend, we really have leveled off overall in the terms of the number of new cases. So that is encouraging, and that's what we were hoping for, and that's a result of everyone continuing to do the right things and take the precautions that we've asked. So I'm very encouraged that we will continue to see a bit of the roller coaster dynamic that I talked about on Tuesday. Really, we believe until we have a vaccine. But in the immediate term, we absolutely have leveled off and are back, and we'll talk about the numbers in a moment, but back now below that 1% of new positive rate for 72, actually for 96 hours straight. So that is very good news. I do want to just remind everyone, and for those that didn't tune in Tuesday, I shared two graphs from leading research institutions, one from the United Kingdom, one from here at the University of Minnesota, top epidemiologists and doctors and scientists that have mapped out sort of what this looks like really until we have a vaccine. The reality that, yes, we have had a major and devastating peak of COVID here in New York, in our region, and in much of the country, but given the way that viruses operate and without a vaccine, it is very likely that we will see a series of essentially spikes or peaks. And our goal here is not to completely eliminate any of those going forward, because that's near impossible unless we remained on complete lockdown, which we know we cannot do. So our goal really is to make those resurgent points as low of a peak or as flat as we possibly can. And you can see on this first graph, which comes from a leading British think tank. This was back in March of 2020. You can see temporally that we really are right around the bottom of that first trough there in July of 2020. But the possibility for numbers to go back up exists. And that is really what we have to maintain our guard against and keep our guard up. Another graph that's a little bit of a variation on the same theme. These are three different possible scenarios laid out between really over the next 2 years from the University of Minnesota study that I mentioned. And what I wanted to really show here is that these are the way these scenarios play out is largely dependent on each of us and how responsible we are and how mindful we are of the continued risk. And so how big any additional peaks are very much depends on what we do now and in the future. So we will continue to update you both on the moment, but also put it in that, I want to make sure we keep it in that larger context of what the next months and possibly even more than a year might look like, as until we get to the point where we either have a vaccine or a much more effective treatment for the symptoms of COVID, which unfortunately we don't have either yet, but we are making progress. Back to Ulster County, in terms of hospitalizations, we remain where we were 48 hours ago, which is a good number. Only one individual hospitalized in Ulster County for COVID-19 right now. Good news. In terms of active cases, this graph does show you, if you sort of look at the far right of that graph, you can see that over the last basically week or so, we, rather than continuing to decline, we did level off and even have a small spike in active cases over the 4th of July holiday. But we now have, as I said, leveled off, and we're holding pretty steady there, right around currently 137 active cases of COVID-19 in the county. So as long as we continue to maintain around that level, we're pretty comfortable there, but we of course don't want to see that number go back up. And then the final metric that I think is most important, again, for early detection of any resurgence, and this is where you can see that spike that occurred starting around July 1st. This is day by day the number of new positive COVID-19 cases of Ulster County residents. So very good news here. After, again, we did have a small resurgence, things have looked very good over the last 72 hours. We've tested 1,615 residents, and only 11 of them have been COVID positive, new COVID positives in that 3-day period. So that's a 0.68% infection rate. That is much more consistent with where we had been for the last few weeks, and that's really the most encouraging news to share with you today, as opposed to 5-6 days ago when that percentage was up over 3% last Thursday and Friday. So this is all going to somewhat go back and forth, and it's going to depend on these small clusters that we see emerging. But what it really depends on is it's almost inevitable that we will have some number of small clusters and resurgence. The key is to quickly identify and contain those so that they don't become larger clusters or, God forbid, get to a point again of community spread of COVID-19, which we are not at. And that's really why we set up our rapid response plan, which I'll talk about here in just a moment. Hospital capacity, the last graph that we always update you on, we are looking very good here and look good going into the future, thanks to our hospital partners at Health Alliance as well as Ellenville Regional Hospital. So shifting to the rapid response plan that I talked about and what we're really doing to ensure that as we see small clusters emerge, that we're quickly identifying them and really containing. There's the 5-step rapid response plan, which I've talked through with you before. So I'll just quickly again remind you, it's identifying any new cases and determining if they're clusters. So that's really that second step of investigate. That relies on the contact tracing process, which really means everyone's participation in that is critical to make sure that we can effectively ensure that if clusters are emerging, we take care of them. Third is isolating through quarantine, and then throughout ensuring that we communicate with the public and with you all, as well as enforcement, which we'll talk a little bit more about here in a second. But enforcement, as we know, is key, and that is absolutely has been, and even more so is a top priority for me and for our team here, and we'll talk more about that in a second. One of the things that we're doing and that we know is critical based on all of the science, that first step of the rapid response plan is identification. And the way that we have right now to identify any new COVID cases, of course, is testing. testing, testing, testing. We've been working for months to build a more robust testing capacity, which we have done. We've seen our testing numbers go up. If you're a regular watcher of these updates, you know that those blue bars on my favorite graph show how much we're building our testing capacity, and we're now at the point where we're doing every day between 500 and sometimes over 1,000 COVID tests in the county, which is great, and we have the capacity to do more, which is important. So how can you all play a part if you're concerned, like I think we all are, about possible reemergence of COVID? Get tested yourself, your coworkers, your family, and others that you know. Anyone and everyone is eligible and encouraged to get tested. And so actually beginning this weekend and into next week, we are going to launch a week-long effort. And I'd ask your all's help, not just to do it yourself, but to spread the word for Ulster County to get tested and make sure that this is a critical step that we can all do. It's relatively easy and relatively painless and at no cost, to make sure that we test as many people as we possibly can. So we are launching Ulster County Get Tested Week, and we'll be spreading the word on social media and ask for your help to spread it among your friends and family on social media. Hopefully you're not seeing too many people in person, but if you are, to spread the word that way as well. But it's critical that we continue to ramp up the number of people that are being tested. As folks are getting back to work, we have started to see a few clusters emerge in certain workplace situations, and those could present significant risk, especially if there are lots of customers and lots of employees. So as you're getting back to work, that makes it even more important that you and your loved ones get tested. So what are we going to do to make sure that we can support this Get Tested Week? We have, over the last, months we've been building our testing capacity. But in the last few weeks, we've actually expanded the number of different places and ways and locations that residents of Ulster County and even from neighboring counties that need to be tested can make sure that they get tested. And so as part of our Get Tested Week effort, we've updated our Ulster County NY website. We are sharing with you a more comprehensive list of all of those testing sites. I won't go too in depth, but I do want to show and talk through the fact that we now have really two different kind of styles of our testing sites. Before, it was obviously the drive up, what we call mobile testing sites. We still have several of those going. They include Health Alliance of the Hudson Valley site, which is in Midtown Kingston at Grand Street. That's both drive up and walk up. Ellenville Regional Hospital. We also have brought online, and thanks to them for their partnership in this, both Rite Aid in Kingston as well as multiple CVS locations in Ulster County and in the wider Mid-Hudson region that are, as well as additional Rite Aid locations that are offering COVID-19 testing. In addition, many one hospital system and many healthcare practices are now offering walk-in testing sites as well at their existing office locations. So Caremount has and continues to offer those off of Route 9W in the town of Ulster. Emergency One has multiple locations, including one in Kingston that is offering testing. And then Nuvance, formerly HealthQuest, has multiple sites, 5 different sites that are part of their HealthQuest medical practice, including out in the western part of the county in Boyceville, in the southern part of the county in New Paltz, as well as at the former Hudson Valley Mall site in the town of Ulster. So I go through this list only to say and make clear that you have lots of options, we have lots of options, lots of ways that you can be tested. Again, at this point, because we have that robust capacity and because we want to stay ahead of this, we are encouraging and asking everybody to get tested, really regardless of your circumstances. We are also continuing as part of our rapid response plan to proactively test at many locations, including our nursing homes and senior facilities And then, of course, including any time that we do have a cluster, we immediately, as part of the rapid response, are sending a rapid testing capacity there from our health department to assess any other folks within that cluster and make sure that they get rapidly tested as well. So please, again, spread the word of our Ulster County's Get Tested Week. We'll know next week. We'll see it in the numbers. If our testing numbers are going up, that will be encouraging, and that will be a credit to all of you, and we will celebrate that. And I hope that of course, as the testing numbers go up, the positive numbers stay flat, or ideally they continue to decline. But the key thing, I think, for us to mentally think about this is not that we'll never have any more COVID, because that's basically scientifically impossible, unfortunately, until we have a vaccine. But that when we do have these small pockets, we're going to quickly detect them. We're going to and then initiate that rapid response plan. I know that's a slightly different way of thinking than we had been before, so I do think it's important to talk that through and understand that. In addition, we've had a lot of questions, including on our Facebook stream and calls to our office and Facebook messages and so on. Even calls to our Recovery Service Center asking about the topic of enforcement. Enforcement of the New York State pause orders has been going on really since the beginning of the pause orders, but we have stepped up our enforcement efforts, especially in the last few weeks, as we have unfortunately started to see a few additional folks or groups or events that in some cases are flagrantly disregarding or flouting those restrictions and regulations, which frankly is very disappointing and frustrating, and it's selfish, honestly, because what each of us does as an individual, we know affects others around us, especially those who are more vulnerable. So I want to make clear to everyone that enforcement of the pause orders and all the things that go with reopening and those restrictions is absolutely a top priority for me, for our whole team. We've talked about this before, but as a reminder, we set up about 2 months ago a pause enforcement task force. And what that really lets us do is hear directly from residents of the county who can make either via a phone call or a website, which is both of them are operating 24/7, can identify complaints or concerns about those that may not be in compliance with the pause orders. Once those complaints are filed, which again you can do via the web or via that phone number on your screen, our local enforcement team, which includes folks from our health department, from my office, from the sheriff's office, who has been doing a tremendous job, as well as representatives from every one of our 24 municipalities, we review that complaint. We assess it if it makes, and then we act on it. That may mean sending a health department inspector, for example, to go up to the HITS horse show, which we know is a point of great concern that we're focused on. We've done that multiple times. It may mean sending a representative from the sheriff's office to go check and make sure that a restaurant has their workers wearing masks and is requiring customers to wear masks. We've done that dozens of, probably hundreds of times at this point in response to complaints. It may mean just picking up the phone and making a call to them to remind them, and in most cases that's what we've been able to do. But again, that works through you all helping make us aware. And so as a reminder that site has been up and that phone number has been up, it still is up, and ask that if you do have those concerns, please reach out. I do want to say this whole thing we're doing here, which is absolutely, at least in all of our lifetimes, unprecedented, which is trying to get our economy going again so we can get people back to work, relieve the economic pressure and the other pressures, but do it safely. This is extremely difficult. This is not easy. It's not anything that any of us were 100% prepared for by any means. And so we continue to work to do it better. And the theme and the message that I think is important is, yes, myself and we as a government have a key role to play here, as do your town and city governments and local and village governments. But this only works if everybody does their part. This only works if we all recognize that and we let the science and the data and the health expertise guide what we do and don't do. If we get to a situation where we're having to actually send law enforcement or send an inspector to a location, that is the last resort, really, because that means that we're using precious resources for enforcement, and we don't have nearly enough to be everywhere all the time. And it probably means that an event or a violation has already happened and potentially created risk. So really my request and my plea to each of you and to those that you know and you communicate with, please encourage everyone to continue to do their part, whether that's you as an individual wearing masks and maintaining distance and washing hands, whether that's you as an employee at a business. If you see your colleagues or the management of your organization not doing the right things, please speak up. If you feel that you can make a call to that complaint line. You can give us a call, and we're happy to get engaged. But please ensure that though you and those around you are doing those right things, because again, enforcement is important. It's important to make sure that we keep people safe, and we make clear that for those who the small number of those who do not follow the rules, we will hold you accountable, absolutely. But we can't enforce things everywhere every time, and if folks do choose to not follow through at a mass scale, that's a real problem. And so this ultimately involves trust. It involves trust that me and our team and our health commissioner, we would only be asking everyone to do these things if they were absolutely necessary. And believe me, we think long and hard about that. I lose sleep over that. Are we getting that balance right? I'm confident that we have, and we are getting that balance right. But ultimately, it is about that trust. That's why I think it's so important to keep you all updated, to use the facts and the science and the data, to rely on our health commissioner, Dr. Smith, that you all know, and other public health experts in the state and nationally and even internationally. So that's what we've done. That's what we will continue to do. And I continue to ask your trust, and will work to earn that trust, that we are doing this for the community and the greater public good. And I hope, believe me more than anyone else, that we will soon be able to put this behind us. But we're not there yet. It is deadly serious. COVID is deadly serious. We know that here. We've seen it. We know it and saw it in New York City. Many states now, tragically, from Texas to the Carolinas to Florida to Arizona and so many others, are seeing the deadly nature of COVID. So we continue to take it seriously as called for, and we'll do that until we get through this. The last thing I ask your help on, and I know this is another thing that we never thought we'd be doing, but this is 2020, and this is the year of doing things we never thought we'd be doing. So another one of those is our contact tracing process. And what this really, again, lets us do as part of our rapid response plan is, if we have one individual come back positive, we now have a very sophisticated capability and team of trained experts who will work with that individual and absolutely respect their privacy and the sensitivity of that conversation, but will work to identify others that they may have been in contact with and put at risk. That lets us essentially take what might be a small little tinder or the beginning of a fire and contain it before it turns into a larger fire that might spread more quickly and get out of control. So if you get a call from a number on your phone that says right there, as you see on the screen, New York State contact tracing, that is not a scam. That is not a spoof. That caller ID has been set up as part of this statewide contact tracing system, which is proven very effective and has been key to our ability to contain these initial outbreaks. So if you get that call, I know it's a little weird, I know it's a little uncomfortable, but please pick up the phone, engage with those folks. The privacy and the confidentiality of that information will absolutely remain paramount, but it will help keep even your family and yourself and definitely others that you interact with safe and healthy as we get through this. Final notes, and I know I'm being the sort of, I feel like I'm being the heavy here, but that's, I guess, the job today and lately. The last reminder, and I said it before, but we'll close on this note. Each of us individually has not just the responsibility, but we're actually empowered to affect how this goes. And the way that you are empowered to do that is just by following really 3 basic things. When you're out and about, or even when you're in an office setting or an indoor setting where you're in close contact, please wear a mask. Secondly, maintain that 6 feet or more of distance. We know increasingly from the science this is an airborne spread disease, so that distance is the safe distance at which the droplets that might contain COVID will fall to the ground rather than spread to others. And finally, please wash hands and use hand sanitizer, which we know is a critical part also of, if you do get exposed, quickly making sure that you don't spread it. So please continue to do that. As I'm out and about, minimally, but as I am out and about, 99+% of people are absolutely doing the right thing. And thank you so much for being one of those people. I especially imagine those that are watching this update probably are in that category. So as long as we continue to do that, and then we work on our enforcement on the margins with those that aren't, I'm confident we can get through this. As we do, final kind of closing, more positive notes, we will continue to make sure that the critical recovery needs of our residents are met, primarily our food needs and our housing needs, but in this case, Project Resilience continuing to go on. We've now delivered over 264,000 meals via prepared meals originally, and now via grocery delivery. Thank you to everyone. We still see philanthropic contributions coming in. We still have hundreds of volunteers doing this work across the county. So thank you, everyone who's been a part of that. And finally, a more broad thank you to everyone, especially all those that have been on the front lines of this in the worst of it, and continue to be, from our first responders to our healthcare workers, grocery store staff, public transit workers, our teachers, pharmacy, law enforcement, and mail and delivery workers, journalists, and so many more. Thank you. We're going to continue to need to lean on you, hopefully not too much, but we know you're ready and will continue to be. I also want to thank Radio Kingston and the whole team at Radio Kingston for helping us continue to keep you all informed. To our interpreters and translators, Diane, and I think Manuel is still translating to Spanish. Thank you. Muchas gracias. Thanks everybody for tuning in. Our next official update will be on Tuesday, which will be at 2 o'clock. At that point, we'll be looking closely at the testing numbers. We will have started our Get Tested week. So let's please each do our part. If you can even ask 3, 4, or 5 people, either in your family or your workplace or your friends, hey, encourage them to get tested. Let's try to aim to have well over 1,000 tests every day next week. I think we can do that. We'll see if we can let's push the limits of our testing system in a good way, and get as many people tested so that we can rapidly identify and keep us all safe. Thank you for tuning in. Stay safe, healthy, and be resilient, and we will see you on Tuesday.